You turn on the mic, Sheena?
There we go. Board Member Roberts,
Yep. Thank you.
Board Member Simbahan. Present. Board Member Lagodakis.
Here.
Board Member Cushing. Board Member Khan, absent. Board Member Cook, absent. Board Member Stratman, absent.
Right, thank you. May we have a motion to approve the agenda?
This is Marlene. I move we approve the agenda.
Second it.
It's been moved and seconded to approve the agenda. All those in favor say aye.
Aye.
Opposed? And the agenda is approved. Next is the approval of the June 26, 2025 board minutes. May I have a motion to approve?
Motion, we approve the board minutes of June 2025, 26, 25.
I second.
It's been moved and seconded to approve the minutes from June 26, 2025. All those in favor, please say aye.
Aye.
Aye. And opposed? None. And the minutes are approved. Next item on the agenda is visitor comments. Do we have any visitors?
Hi, Katie Homeland, Youth Program Development and Advocacy Coordinator. I just wanted to take a quick opportunity to say thank you to the community of Petersburg. We just wrapped up our youth kayak expedition for another successful year, enjoying the sunshine, which is pretty amazing in itself. But what else is really amazing is we received grant funding for a new fleet of kayaks, thanks to the Elks. But due to some shipping delays, those did not arrive on time. And kind of in the 11th hour, the team and I scrambled, and Petersburg showed up for our kids again. And we were able to pull together a whole fleet of kayaks that were seaworthy and safe for our children to be using as we navigated the waters around Mitkoff Island. So I just wanted to say thank you for making it possible. It really does mean a lot to our kids to see our community showing up for them. So thank you for helping to make it a success. And I really do greatly appreciate it, but I really look forward to our fleet being here so we don't have to scramble again. So, thank you.
Thank you very much. Are there any other visitor comments? Moving on to board member comments. Does anybody have anything they'd like to share?
This is Marlene. I was sorry I missed the paddle battle. I was out of town, but I heard it was a great success from participants and from fundraising point of view.
It was, and I think the weather cooperating really helped people's spirits too. Anyone else? Moving on to committee reports. The first committee report is Resource Committee, and I have a report for that. Jason reviewed hospital statistics. We had a meeting on July 21st. Indicators are trending upward for the year, and that includes primary and specialty clinics, radiology procedures, rehab services, and home health visits. Swing bed days are influenced by whether or not there is available space in long-term care. We had over a 17% increase in revenue from last year, some of which is a result of the change in our charge master. And our charge master is the database in which all billable services, medications, and supplies we can provide for a fee are listed. Our internal rate review is finished and did not result in any lump sum repayments, or at least not as yet. A couple other notable points that are in our accounts are that our accounts payable is caught up, our cash is strong, and the board agreed to move some funds to an investment account that is not speculative and from which we can easily retrieve funds when needed. And we're also working on renegotiating rates with current billers and working on cooperating with new providers as part of our initiation of the 340B program. And we also discussed the certificate of need process. And as Katie reported before, there are some changes to our grants. Some funds have been pulled back, but there are still some opportunities we're taking advantage of, and Katie and Sarah can describe that in more detail. And a really big news is the MRI was delivered last week, and the furniture for the new work building is starting to arrive. So that concludes the resource report. And then for long-term care and The CAH report, Board Member Stratman will be reporting in August. And then for staff reports, we had a staff report for home health from Laura Holder. Does anybody have any questions on that? And the next report was imaging by Sonia Paul. Any more to add, or anybody have any questions or comments?
Just exciting to see the pictures of this gigantic machine.
Big
And-
magnet.
Yes.
It's going to be very interesting to, if we can tally over 6 months or a year, how many people don't have to be medevaced out because we have this, a functioning MRI.
And then for lab, Violet Schimick submitted a report. Does anybody have questions, or do you have any comments to add to that? Hearing none, we also got a long-term care report from Helen Boggs. And it was a lovely report. It sounds like lots of good things are going on in long-term care. And Patient Financial Services, Carrie Lantine submitted a written report. Are there any comments or questions on that? And then new facility, Jay Wetzel from Arcadis submitted a written report. Any comments there? Did you have anything you wanted to address? Guys are making it easy tonight. Quality and infection prevention, Stephanie Romine and Rachel Candle submitted reports. Any comments or questions? And executive summary,
Okay.
CEO Phil Hofstadter.
I won't take up too much time. I submitted my report. Want to also commend Katie and her team. I was there at the kayaking expedition, and it was really amazing to see the kids and the cohesiveness and sort of just how wonderful that was. So I spoke on that a little bit at the KFSK Live as well. So very, very good. And along those lines with the activities, the pedal and paddle battle, we raised a little over $24,000. So thank you for everyone participating. We had great corporate sponsors, and we had prize winners. I noted in the report, and then we had 23 paddlers and 15 bikers, which I think is actually the most we've ever had on as a ratio. We usually have more pedalers than paddlers, so that was great. Good day. The weather helped certainly, and I just want to be very thankful for everyone's donations. It goes towards scholarships and continuing education and laddering up in our facility through the Petersburg Medical Center Foundation. Thanks to Julie, Sue Paulson, and the foundation members as well. I guess I'll put a plug on the sponsor. I'm glad there's a list here. That's kind of what I wanted to do. We had corporate sponsors included Alaska Airlines, Lee's Clothing, Rockies Marine, Rexall Drug, Petersburg Properties, Anchor Properties, First Bank, USI, AP&T. USI is our broker, by the way, for insurance. So they've been a great help in addition to our fundraising in the past few years. AP&T, Petersburg Mental Health Services, Last Frontier Eye Care. So Dr. Cap provided some donation. Dawson, Arcadis, thank you, Justin, for that. And Bettersworth North, our architect. So it's nice to see some assistance from our corporate sponsors on that end. I have one adjustment just on a data set. I was reporting out on a data set, and one of the anomalies I was looking at was medevac, and I couldn't believe how many medevacs we had when I first ran the numbers, but it's actually, I reported out 73, which was probably the highest I've ever seen. I had that double checked just to make sure, and it actually wasn't 73, it's 59. So still high, one of the higher numbers we see, close to 60, are numbers we don't typically see, but I just want to make sure that was reflected in the adjustment. So,
But it does show we had an average about one a week.
yeah, it is definitely is very high. Both the volumes in our inpatient and our swing bed, and just seeing a large number of medevacs as well in the past year. And so that's in the past fiscal year. And the CON, as mentioned, was submitted and received at the state. So we're just waiting that formal process and review. So we will, that certificate of need is what we need to start seeing patients in the MRI. So it'll be a welcomed opportunity. I'm so glad to see that application go through. It's pretty complicated, very onerous, and a lot of time spent. So it's very great. And then Jason's going to talk about financials. New facility has been is wonderful to see. We're able to go up there freely. I was just up there a little bit with Justin, and Sonia was up there, and seeing our IT team getting things set up. So it does look like from a just logistics state and the shipping and getting things installed, we're probably looking closer into September as really as a where are we going to be able to use the space with technology and the equipment landing and everything installed. So we will be moving in as we go. I know public health will be moving in August, but it's just it's going to be a slower process. And just to give you an update on that, shipping has certainly been a challenge as well for some of our installs. And that's all I had. Did anyone have any questions?
Questions? I don't have any questions, but I wanted to put another pedal battle plug in because I was always the naysayer about the pedal part. But it was really fun to see there were younger kids here that participated this year, I think, than I have in the past. And they had a blast and they did well. The weather was really accommodating, but they had a great time. And it's kind of encouraging to see younger folks getting involved in activities like that as well. So thank you, Katie, and everybody who helped out with that. And I also wanted to put in a plug for Liz Bacon, who I think helped coordinate the food for everybody too, and the kitchen at the hospital. Next is the financial report, and Jason, you're on.
Sure. So Cindy did an excellent job of summarizing the meeting from the resource committee. So I'm really going to have to scratch deep to find a few things that might be new or different from what she already shared. But I'll do a quick summary of the financials. We'll go through the statistics as we always do. So just, really highlighting the strong support from the community and the hard work from the staff. So, the clinic is up volumes, both in terms of the primary care clinic, specialty clinic over the prior year. Radiology procedures are higher by about 11% from the prior year. The lab is down just a little bit because we didn't do a lab health fair this year. We do those every other year. Rehab has rebounded very strong, 12,891 for the year, over 10,249 from the prior period. Home health has also rebounded well, 2,296 over 1,717. Emergency rooms up just a little bit. We were, it's fairly consistent. We see about 60 to 70 patients in the winter, but in the summer months, hitting about 90s. We saw 94 in June. So we're up 907 over 872 from the prior year. Hospital, the patient days, 373 over 351 from the prior year. So up about 20 patient days from the prior year, but swing bed is up significantly, 827 days over 441 from the prior year. And then we also have ICF days, which are the residents who are waiting to be placed in the nursing home. There's 374 days there, so almost one a day, just over one a day versus 11 in the prior year. So the long-term care has also been very busy. We're at, I believe, 87% capacity for the year, 90%. So for 403 resident days here in the month of June. So very, very busy. So as we look at the income statement, we can see that revenues for the month and for the year are well above budget and above prior years. So for the month, it's 257,000 above the budget, and then year to date, we are 3,673,000 above budget. Net patient revenue, similar trends. Contractual adjustments running about the same as they were last year. We did have, let's see, sitting in the next section. So when we look at other revenues, most of those items, 340B revenue is new, but we had 58,000 in revenue there. And PERS and USEX grants similar, but we did do a correction. So with the passage of the One Big Beautiful Bill, there were 3 quarters that we applied for the employee retention tax credit, and that bill makes it so that the federal government will no longer pay out for the 3rd quarter. So we lost 30% of, or a third of what we had applied for. Originally, we were awarded, not awarded, we were eligible for, the application hasn't gone through, for $3 million. So with that passage, we've made a correction here of about $972,000 reduction for that. We've also reduced the expense associated with filing that piece of the application. So a little bit of a deduction there. Total expenses are above budget for the month, $94,000. Year to date, 2.5 million, but that's supported by the increased revenues. So with the correction that I just commented on, the net income is a negative 589, but had we not done that, it would have been a positive, $400,000 there. So year to date, we are showing a net operating income of 3,100,000, and most of that, 2 million of that, is coming through because of this employee retention tax credit. So I look forward to receiving that. It will take probably about a year to 18 months for the IRS. They are quite backlogged and understaffed. So, and then investment income, other operating gains, very strong. So for the month, our change in net position, or excuse me, our change in net operating gains was change in net position, excuse me, 444,000, and then for the year, 16 million. Might be a while before we see some, a bottom line that large again, but once again, that predominantly is due to the grants that are associated with the construction project, and then the 2 million for the ERC. A couple of things, as was commented before, our cash position is very good. We transferred a little bit of money into our short-term investments. Accounts payable is caught up. Business office is working hard on the recovery from the insourcing of the business office. A few key statistics here, ones that wanted to point out. We actually write off very little with regards to bad debts. The department, the residents in the community and the staff do a very good job of getting those accounts paid, those self-pay balances. Most organizations experience upwards of 3% write-off for bad debts. So we're well below that. So days cash on hand is reaching 100 days. I'm very glad to see that's been growing over the course of the year, up not quite 20 days. So, and then accounts receivable. We've added a new line, accounts payable, showing what's our average time to pay on our vendor accounts, 31 days. So everything's looking good there. So the only other thing I would really comment on in conclusion here is just a little bit with regards to the One Big Beautiful Bill that has passed. As I shared previously, the first impact to our organization is we lost 1/3 of that employee retention tax credit, but we're still getting 2/3, and we're grateful for that. There is a fund that has been set up, $50 billion fund for rural healthcare stabilization and transformation. Sounds like a lot of money, but basically it'll be about $1 billion per state, and each state has to put forth a plan to the federal government and has to be accepted, and how they're going to ensure with the cuts that they've declared that rural healthcare remains sustainable, and services for a variety of things, not just hospitals and clinics, but home health and a variety of other things are still available in rural communities. So we're working closely with the state to understand, what is that plan that they're going to put forth, and we'll try to. We will do our best to participate. We hope that there might be some funds, we don't know yet, for infrastructure. So we'll see what comes of that. But there are changes, but for the time being, I would share with you that over the next 6 months to a year, over this foreseeable time of our budget, I don't anticipate significant changes in our financial outlook. We will know more by the time we prepare the budget for 2027, what impacts will come from future cuts, and we'll keep the board apprised, but I don't see anything compromising happening in the next year. Any questions on the financial report?
The only thing is I don't see Sarah or Katie on. I don't know if you wanted to give a couple high points on what's happening with grants.
Sure. I can take a look at that real quick. Just one moment. Let me pull that back up. I think it's right here. It was here. Hey. We have 4 pending grant requests. Alaska Community Foundation, Exact Sciences, Senate appropriations for congressional district funds, and Senate appropriations. So we're actively trying to pursue different things from those different grants. I think those total $6,590,000. It is a hard season for grants, but never hurts to ask. 2 new facility grants operating in fiscal year 2025. So we received the $28 million for the HRSA and the U.S. Department of Treasury. Just a quick note on that. So as we are beginning to move in, and we'll begin to depreciate that, a piece of this will remain as a construction in progress, because some of those funds were actually spent on the hospital piece, not so much for the U.S. Department of Treasury, but more so for the HRSA Congressional District spending the planning grant, but use some of those funds for the site prep and that. So 9 programs, personnel grants, $800,000, such things as Alaska Trustees, Children's Trust, Alaska Community Foundation, ACL, just a variety of things. Katie Bryson does an excellent job in going out, finding things and preparing the documents, building relationships with the grant donors, and finding ways to come up with those funds. And then once we receive them, we have an excellent staff in the organization who administer those programs, and Sarah does an excellent job in processing them. Sometimes Sarah, she does share in the resource committee where we sit with the expenditures and the payout on the big grants for the construction progress. We're nearing the end of that, because we're nearing the end of the construction. I think we have a couple more months of a few funds that will go through that, as we pay for the MRI arrival and some of the furniture and equipment and final retainage probably on that grant. So.
All right. Thank you very much, Jason.
Welcome.
Any questions? Everybody's pretty quiet tonight. Next item on the agenda is old business, and there is nothing that is listed under old business. And after that is new business, and there is nothing listed under new business. So you're getting off easy tonight. Our next meeting is scheduled for August 28th, and that will be in Borough Chambers. And the very last item on our agenda is an executive session, and I need a motion to go into an executive session.
I move that we enter into executive session to consider medical staff appointments or reappointments or any legal concerns.
Second that?
Jim, it's been moved and seconded that we go into executive session. All those in favor say aye.
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 Opposed? None? And we'll take a 5-minute break until we get the room cleared. And thank you, everybody, for coming.
Thank you, everyone. Congratulations on the arrival of the MRI.
Thanks, Jason.
Yeah, that was wonderful.
I'll be back in a minute.
Okay, thanks.